Hello everyone. I hope you are doing great today. If you are new to my channel, welcome. This is Hoàng Nguyen, the coding expert, dedicated to helping you master medical coding and pass your exam with confidence. In my last video, I assigned a homework case to test your understanding of the IC10 CM official guidelines. Now, it's time to go over case number 3. I hope you took the time to work through it because hands-on practice is key to sharpening your coding skill. In this review, I walk you through the correct sequences, guideline rules, and essential coding concepts step by step. We will analyze the case, eliminate incorrect options, and apply official IC10 CM guidelines to determine the right answer. Make sure to follow along, take notes, and compare your answer. Let's get started. Case number 3. If you are new here and have never watched any of my videos, how do you feel when you see a case like this, or even a longer one with multiple codes in the answer choice? Do you feel overwhelmed, confused, and unsure where to start? Is your anxiety starting to build up? Sound familiar, right? Now, imagine the worst case scenario. You come across a page or two of an operative report filled with medical terms you never heard before, and once again, you are faced with multiple CPT and ICD-10 codes in the answer choices. It feels like navigating the Amazon rainforest, right? Do you start feeling nervous, frantically flipping through your book, looking up every single code, and hoping for the best? By the time you finish, 15 minutes have passed when you were supposed to spend less than 5 minutes on the case. That is the reason why I developed the reverse analysis method. In simple terms, the backward approach. Instead of starting with the operating report or case question, you focus on the first column of codes in the answer choices. By analyzing, breaking down, and looking up this code in your book, based on the code description, you should have an idea of what this case is about before even reading the operating report or the case question. Having said that, I don't want you to read the case question just yet. Focus instead on the group of codes listed in the first column A, B, C, and D. B and C have the same code, D64.81, so they are in the same group. A and D have different codes, C34.31 and C34.91, so they belong to two separate groups. Now you have three groups with three different first listed codes, D64.81, C34.31, and C34.91. I want you to pause the video, open Yashi Tensian book, volume 1, and look up these three codes to find out what they are about. Please do it now. Assuming you already looked them up in your IC10 book, here's what you found. Keep in mind that during the AAPC online exam, you are no longer allowed to use a highlighter or any writing tools. Instead, make use of the notepad provided on the screen to keep your code organized. I highly recommend practicing with it, as it will not only help organize your code for the process of elimination, but also improve your thought process. That said, on the computer testing desktop, click Notepad to open the application. Then type the IC10CM code decryption. Remember, you don't have much time to type the entire decryption, just a few keywords, main terms, or short term to help you distinguish between them. Based on what you just typed in Notepad, you have three codes. D64.81 is for anemia due to chemotherapy and 2C code for cancer. However, the only difference between these two codes is that C34.31 is for cancer of the right lower lobe of the lung, while C34.31 is for cancer of the unspecified right lung. After this step, based on the code decryption, you should have an idea that this case involves cancer or malignancies. Your focus when reading the case should now be to determine which code should be sequenced first, the D code for anemia or the C code for cancer. At this point, your thought process should be clearer compared to those who start by reading the case first and become more confused. Now is the right time to read the case. Let's read it. A 68-year-old male with right lower lobe lung cancer presents to the hospital for the management of anemia. The physician determines that the anemia is due to an adverse effect of chemotherapy administered for his lung cancer. The patient received a blood transfusion and iron supplementation during the admission. No treatment is provided for the malignancy itself. Based on what I just read, the patient came to the hospital for treatment of anemia. The physician determined that the anemia is due to an adverse effect of chemotherapy. The patient received a blood transfusion and iron supplementation for the anemia, and no treatment was provided for the lung cancer. Now, I want you to open your notebook, turn to the page you label Cancer Notes last time, and jot down another IC10CM official coding guidelines related to cancer neoplasm chapter. Anemia associated with chemotherapy, immunotherapy, and radiation therapy. When the admission encounter is for management of an anemia associated with an adverse effect of the administration of chemotherapy or immunotherapy, and the only treatment is for the anemia. The anemia code is sequenced first, followed by the appropriate codes for the neoplasm and the adverse effect T45.1S5A, adverse effect of the anti-neoplastic drugs. Based on this coding guideline, when the encounter is for the management of anemia due to chemotherapy, the anemia code is sequenced first, followed by the T code for the adverse effect of the chemotherapy drugs. That says the first listed code must be for anemia, so D64.81, anemia due to chemotherapy, must be sequenced first, so we can eliminate A and D from here. B and C still remain. Based on this coding guideline, we need to report the following code T45.1S5A for the adverse effect of the anti-neoplastic drugs. However, both B and C have T45.1S5A, so we cannot use this code for our process of elimination. Therefore, we have to focus on the second column group of codes. B has 334.91, cancer of an unspecified part of the right lung, and C has C34.31, cancer of the right lower lobe of the right lung. Based on the question, it states that this patient had right lower lobe lung cancer. So C34.31 is the correct code to report. That said, C is the correct answer for this case. Now you can see, when you use my reverse analysis or backwards approach, you don't have to read the entire report, just the information you need to focus on after identifying the difference between each diagnosis or CPT code decryption. This method will save you a lot of time and confusion. I want you to master this technique in addition to learning the coding guidelines. Keep practicing and you will almost guarantee to pass the CBC or COC exam without any problems. In your personal notebook, I want you to make a short note for yourself so you can remember. It doesn't have to be lengthy, just keep it short. Here is the short note from the last video, case number 1, and I want you to pay attention. Cancer comes in for anemia treatment. Cancer code goes first, followed by D63.0. Now, after this video, you should add another short note like this. If a cancer patient comes in for anemia treatment only, and the anemia is due to chemotherapy, then the anemia code goes first, followed by the cancer code and T code. I want you to be careful when dealing with anemia in cancer patients. Case number 4 will be your homework, so please try to do it yourself, and I will go over it as soon as I can next week. That's all for today. Thank you so much for watching, liking, and sharing this video. If you found the content valuable or have any suggestion for future topics, please drop a comment below. I would love to hear your thoughts and feedback. On another note, I'm working on a new online class designed to help you navigate the latest change in coding and the online exam format for 2025 and beyond. Once it's ready, you'll find it on my website, codingwithhong.com. Remember, success is built on the foundation of knowledge. Keep learning, and the possibilities are endless. Until next time, have a great weekend.